Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gawain Vaughn.
The Auburn Medical Group.
What was that?
A place to learn about medical facts with Dr. Mark Vaughn and Dr. Gawain Vaughn.
Yeah, that's me. That was a very strange introduction.
I know.
I wasn't ready for that.
Much more mellow than the usual energetic. Even though I did have the Dutch brothers, thank you to all of our people on Patreon
Yes,
and
thank you.
whose names are on the video at the end, and you can join them too, which is what that message says going across there. You can find the link probably pretty easily. We'll get rid of that for a moment. Dr. Gawain, we're going to be talking about
What are we talking about?
allergies.
Allergies.
So a reporter from KCR3, also My 58, I guess. They show the same news.
Yeah.
Called me up yesterday afternoon asking if I'd like to speak with him about allergies. So he came to my house and we made a little interview and they chopped it up and used this much of it. But I did all the prep
I
for
watched
it.
it. There was a full sentence. You got a full sentence.
So I
in
got to
there.
use the material. So that's why we're talking about allergies today for those of you who are interested in that topic.
So I bet it's a lot of people because it's bad this year.
It is a lot of people. Do you know?
Especially
how
over
many?
here where we are.
It's like a third of people have allergies.
Sounds about right.
Yeah. So this is one of the widest applicable topics that we talk about.
Yeah.
So chat is open and you can, oh, look, Lindsay and Rusty are already chiming in.
Thanks for showing up.
Thank you for showing up, Lindsay. Hi.
Tell us about your allergies.
We're going to be talking about allergies to these folks.
Tell us all about your allergies.
Tell us all the
So
gooey
many different
details.
allergies out there. Now we're talking specifically about seasonal allergies here. So there are different types of allergies out there. We won't get into the
Kind of the hay
specifics of all those
fever,
different
allergic
things.
rhinitis, conjunctivitis, meaning the eyes,
Right,
sort
yeah.
of symptoms.
Yeah, not talking about medication allergies.
No.
or
Or
anaphylaxis
food
or
allergies.
anything
No,
like
this
that.
is, those, they're different topics.
Yep, absolutely.
And actually, to a certain extent, a little different process in the body, too.
Different, yeah.
Yeah. So the regular seasonal allergies typically are to something like a pollen from a tree or plant, a ragweed for a lot of people. Some people will be allergic to mold or cockroaches or dust mites or their cat dander or their somebody else's cat's dander or a dog dander.
So yeah.
It's never my cat.
It's never my cat.
I'm allergic to other people's.
It's always great when people come in and they're like, yeah, I'm allergic to cats or dogs. And they've got a cat or dog and they're miserable. And you're like, well,
There is a way.
And they don't want to get, I get it. I understand how close pets are.
I know.
But it is one of those tough things.
It does seem, okay, so the very first thing that's written on treatment for allergies is avoid the allergen.
triggers, yeah.
Avoid whatever it is. And so you'll have allergists tell people to get rid of their
pet that they've had.
pet that's a member of their family and sleeps in their bed with them and tell them to put these plastic covers on their mattresses and pillows because of the dust mites.
Yeah, you gotta get all that out there.
And it's asking a lot.
It is. Just stay inside all day.
There may be other ways to address allergies other than parting with a pet that you are truly fond of.
You could live in like a
major way,
hermetically
so.
sealed box.
Yeah. So we understand that there's a bit of a challenge there for some people.
Yeah.
And I am sensitive to that. I know there are situations where
we enjoy our pets.
You don't ask a person to part with something that they're that emotionally bonded to.
Go cut down all the oak trees on your property.
Now here's the problem with that is it's the neighbor's tree.
Yeah.
So
just across the way.
Just move to a different part of the country with a different climate and you'll be good for 2 to 3 years or 3 or 4
I've had
years.
people do that. Yeah. And then you'll get used to those allergens. And that's about how it was for me.
Yeah.
I moved to San Diego, and then my senior year of college, got allergies there.
It's 3 to 4 years that it takes
and then,
for you to
same thing in Loma Linda, same thing in Reading. Then I came back home, and they were there already.
And then,
I was already
way.
exposed to all those things. So.
Yeah. So, the first thing is avoidance, and that can be through, in some instances, it actually is the family picking up and moving.
Yeah, we've seen it.
So that you don't live with allergies. If you have other reasons to consider the move, if it's not parting from your entire family and friends and network of 40 years or whatever, that'd be a little harder. But it is one of the ways to avoid triggers.
That would be.
Get out of the climate where those triggers live. Mm-hmm. Now, how do you know what your triggers are? What you're allergic to?
Well, most people don't. They just kind of assume that it is during a certain season, so that's when certain things are blooming. So you kind of just make assumptions, and you say, okay, it's during this time. That's when the cedars are dropping all their pollen, or when the oak trees are blooming. Now,
or the
other way is to actually get tested, and there's a bunch of different ways to get tested. The two main ones are like blood tests versus like skin prick tests or RAS testing.
And the allergists still like the skin testing.
They still like those. Yeah, they say you can't put a lot of faith in those blood tests because they don't always match. So they said they like those. Now I don't know if that's just because they want you to come in and get that test done, but
doesn't hurt that they get paid for it. That's the procedure.
Yeah. But that works. That's how I found out that my son is very allergic to oak trees, which we live right in the middle of.
All over your property.
Auburn, California is all that we have.
Okay.
The poor kid is miserable this time of the year, spring.
Let's take a chat break, shall we? So Lindsay says you just have to suffer through it.
Well, that's one way to do it. There are treatments. We'll talk about some other treatments.
I think she was talking about when we're trying to tear her dog away from her.
Oh, yeah. Or you can treat
Rusty B, fluticasone propionic generic over-the-counter twice a day.
It's a good one.
Rusty B, you get brownie points for the day. We're coming back to that. And then Lindsay, those are my biological dogs.
Nice. Can't part ways with those.
They're not adopted.
They're not
my biological dog.
That's funny.
Nice. That was good. Okay.
Yeah.
My biological dog.
So.
Okay.
So if avoidance is not an option, then...
I was going to circle back to testing. We don't send everybody for testing.
No.
It's the exception. It's not 1 in 3 adults who needs testing. Most people, we can talk about allergies, and we'll go over what we do with most people.
And most people are
some
mild symptoms. I mean, if your symptoms are severe, you probably should see an allergist and may need some more testing and figuring it out. But most people, mild allergies, we can treat it with certain medications. Most of them are over the counter even. So
if we can get a satisfactory solution,
just
with the easy to prescribe and avoidance exercises.
Try that first
in our office. So sounds like you were gonna jump right into the over-the-counter agents.
Sure. Yeah, because that's what probably most people have tried or know about.
Yeah, advertised all over TV.
Yeah. And
let's pause for a commercial.
There we go. Yeah. This is not brought to you by any of those. So if we want to put them into two general categories, maybe we would put them into like systemic medications and like focal or localized.
Systemic is working through your whole body. Yeah. It gets into your bloodstream when you take a pill.
So these are ones that would be in pill form. So the old ones way back when, first generation antihistamines would be like Benadryl and what was that other little yellow pill that
chlortrimeton?
Yeah, chlortrimeton. That was the one my dad really liked.
Why don't we use those anymore?
We do. Yeah, we do, but we try to avoid them because they have side effects, and some of them are severe, especially if you're older. They can be very severe.
Cause mental status changes that are associated with
bladder changes,
really bad outcomes.
Yeah. So we try to avoid those. So there are some newer second generation antihistamines which actually work better and are definitely cleaner in the way of side effects. And the major ones there would be three major ones: Zyrtec, which is cetirizine, Claritin, which is loratadine, and Allegra, which is fexofenadine.
There's two forms of the Claritin / loratadine. There's the Claritin and the Clarinex.
Yeah.
And that's loratadine and desloratadine.
Yeah.
Very minor difference. One of them comes in 5 milligram, the other comes in 10 milligram. Maybe there's less side effects with desloratadine.
Yeah. The way I remember it, the green one, the blue one, and the purple one.
Well, they come from different manufacturers.
Even
now.
the different manufacturers have the same colors.
Huh?
Yeah,
Do
like
they?
the
All
Walmart
right.
brand or the Target brand, they still have the same colors.
Okay.
Anyways, minimal side effects.
Do still
They're
have
pretty good.
that effect, though. So if you're taking other medicines, like elderly people often do, that have this effect called anticholinergic,
Less, but it's still there.
this still can push somebody over the edge. So we need to be careful in our use
the
of them.
elderly, yeah.
And only use them when something without that effect isn't getting you the result you need. Discuss with your doctor.
Yeah. As with all of the advice we give, don't take our word for it.
Yeah,
Talk to your
discuss with your
doctor about it.
So those are the pills that have
Those are the
systemic
pills,
effects, meaning whole body.
Yeah.
Neurologic
So they
effects.
can, but because they go through your whole body, they can treat all of the symptoms that come with it, which would be nasal discharge and swelling, the eye redness and itching, the itching in the back of the throat, the ear itching. It can treat all of that.
Sometimes the skin.
Some people get
also.
that too. Yes.
Not as good as the Benadryl for that, probably, but
Yeah.
yeah. And the Zyrtec, maybe, I know they market it as better for the skin type things. I don't know if that's real or not.
Yeah. They're all 24-hour. Well, no, sorry. Fexofenadine is 12 hours, but the other ones are 24-hour pills, so you just have to take it once a day, which is kind of nice.
I think fexofenadine's once
Does
a
it
day,
come
too.
in a 24-hour pill now?
Is it
It used
150
to be.
milligram?
Yeah, I think it's a higher dose for the 24 hours.
Okay.
I'm not sure it lasts all the time. It's
Yeah.
pretty good, though. It works. That one works really well. So so then the other
The
way.
packaging will say.
Yeah, read the packaging. Don't take our word for it. The other ones are treating the symptoms that are bothering you, like right directly at those symptoms.
And Lindsay, of course, points out that the Benadryl dreams and flushed face.
Oh yeah, it'll do those.
And I'm sorry, Lindsay, I can't get your
Oh, is your
chat.
chat not working?
Yeah, it was working earlier. I realized, really, believe me, but she knows. She saw it up there.
But yes, Benadryl
But she says
dreams.
Benadryl dreams
It
and
will
flushed
affect
face, which is what it will do.
Yep. Yeah. So most people get focal symptoms with
Yes.
seasonal allergies.
Don't need
and
to-
the primary one is the nose.
Yeah.
Sneezing, nasal discharge, nasal congestion. And so that can be treated with a focal treatment.
Right. Just spray
And
it up
somebody
your
already
nose.
said it. Rusty B, strong work.
Yes, he gave a brand name, if I remember correctly.
No, he said generic.
Oh, he said the generic name. Good job.
Fluticasone.
So the brand name of that would be Flonase, I believe.
Yep.
And then there's Nasonex, which is very similar.
Yeah, and these are just
I don't remember.
steroids. And I know you hear steroids, you're kind of
Yikes, steroids.
However,
What?
it's a very low dose and it's very focal.
Now her thing comes
Now
up.
it's working.
Now it's working.
So it, works right on the nose. And
It actually does help for the eyes, too.
Nasal spray. Yes, there is a
Nice spray
little
nose.
bit of a help there for those who have eye symptoms as well. But yeah, just use typically one spray in each nostril. Don't snort it. Back in the throat does no
Yes.
good.
Pro tip. Tip your head forward so you're not trying
Opposite
to get it.
hand.
You don't,
Then you're not
there
spraying
you go.
into your
That's
septum.
right. That's right. Yes, you don't want it hitting the septum. You don't want it going back and swallowing all of it and getting it down your throat, which actually can contribute to thrush.
It doesn't taste good.
You want to
How would I know that?
have your head forward, spray it with the opposite hand, and know that it's going to feel like it's running out.
Yeah.
It feels as if, oh my goodness, I just sprayed this in my nose and the whole thing just came out. What a
All
waste.
coming out.
Don't worry about
Yeah.
it. It coated what it needed to coat. It does run out. Have a tissue there to catch it, and you're good.
Yeah. Yep. So that's the nose. And very effective. Actually, first-line treatment for most people with allergies.
Before the pills.
Yeah. Before
We go to the
because
pills when it's not getting enough
focal.
effect.
Yeah.
And then there's another spray. Antihistamine
There
sprays
is.
like
Yeah.
Astelin
Yeah.
or Astapro.
Right, which is different than Afrin, which you do not want to take long term.
That we don't recommend.
Do not write. So Astelin, not Afrin.
So Astelin, you know what's coming.
I do.
It's called Astelin, but even though it's not called Nostelin, you're supposed to spray it in your nose.
Yes.
I don't know why they called it Astelin, but spray it in the nose.
That's right.
Yes. We don't have a laugh track on this show. We're too good for that.
At home. There.
Yeah.
So that is and then there are eye drops.
Yeah.
For those who have eye symptoms. So my son has horrible eye symptoms when it comes to his are mostly eyes. He does get
rub your eyes.
Too. I
can still hear my
so he
parents
does
telling me
use
that.
eye drops.
Don't rub your eyes.
Pataday is kind of the common one. That's a really good one. There's also Zatador, which is kind of a twice a day one.
I think there's
just once
both
a day.
antihistamine and leukotriene inhibitor drops, if I'm not mistaken.
Yeah, there are.
I don't remember which is which.
But Pataday is what the over-the-counter you can get that works really well. You take once a day. So.
And if the combination of those together isn't doing the job, we can refer on to an allergist.
Yeah, and they can do other things, skin testing, and then do directed therapy called immunotherapy with
people
injections.
with really bad symptoms.
So where they essentially give your body a little bit of it so your body can kind of slowly build up. Is one way to put it, I guess. Build up a response.
Homeopathy? Is that what
there you go.
Are you promoting homeopathy?
Yeah. That's what you should do. Just
a little bit of the thing that causes
the oak leaf, inject it into your shoulder. No,
so
that's
this
not
is the
what I'm
one
saying.
area where that actually works. And it's called immunotherapy, and it actually is kind of the principle of homeopathy
but in this case,
a very small dose, except it's not indistinguishable or
build up,
immeasurable or undetectable. You actually are giving enough that does something, but it's a small amount.
Right.
To on purpose get your immune system.
And that works. It takes a little time for your body to build up to that, but
yeah.
it works and it has lasting effects, which is kind of nice.
So this works for things where the body is having an allergic reaction to it, not other things like whatever the poison was.
Like, what are you trying to?
Princess Bride, where the
iocane powder. I'd bet my life on it. Because it's tasteless,
not
and there's no smell,
That's right.
and just a little bit of it'll kill you. And he sniffs it and says it's iocane powder.
Even though it's odorless.
Anyways.
I don't remember that much
there.
detail.
A little bit of a plot hole there, but...
Apparently he remembers watching it more times in his childhood than I did.
Maybe I've seen that a few times.
Watch it with your own kids. Okay, so with that... Oh, Inigo Montoya is right in.
Inigo Montoya.
Okay, so we're caught up with our fans out there in YouTube land who we really appreciate. And actually, I do have a bit of an announcement. No.
Okay.
No, I'm not.
Let that cat out of the bag.
My biological cat. So, did you hear about the guy that dumped all the kittens out on the corner?
No. What?
They arrested him for littering.
Oh gosh. I'm no good.
I love it. It made me laugh.
Animal. Oh, here's a good animal joke.
Oh no.
What do you call a religious female beaver? A nunchuck. My son told me that one. That one made me laugh out loud. All right. Anyways.
Okay.
What is your
my announcement? Yes. Okay. So
that I distracted you from.
You may not know this unless, for some reason, your hobby is looking at the number of views each of our videos has weekly. But I see the statistics, and I found that we got like twice as many views as we were getting recently. When YouTube somehow they have this way of indicating that a YouTube channel that talks about medical topics is actually legit. Oh. These are real doctors, and you can actually get real medical information, not totally out there fake news stuff from YouTube channels that have this designation. And we have it. We got it. They finally looked up our credentials and
you've got the blue check mark.
You are essentially, yeah. It's like the blue check mark of well, what blue check mark used to mean.
Yeah, we're not paying for this.
Yeah, we're the real thing.
We're just giving good advice.
Yeah. So that's something news about the channel, and we're glad for that.
Awesome.
So anything else you wanted to throw out there before?
I don't think so.
Finishing for the week. So next time we come back, we'll talk about another topic. And until then, Dr. Gwen Vaughn and Dr. Mark Vaughn telling you to stay in good health.
Doctors, thank you for another informative session. Auburn Medical Group is located in Auburn, California, USA. Thank you for participating. Please tell a friend and join us again next week.